Thank you so much, everyone. The Alzheimer's Society of BC is really pleased to be a sponsor for this year's Dialogue on Aging series presented by Providence Health. And thank you so much for inviting us to speak to you about COVID-19 and dementia. So as Mark mentioned in his kind introduction, the Alzheimer's Society of BC is a provincial charity dedicated to helping anyone concerned with or facing dementia have the confidence and skills to maintain quality of life. So my name is Avery, and I'm here with my colleague Mariana, and we're part of the advocacy and education team at the Alzheimer's Society of BC. So we have a 25-minute session today, and here's our plan. So we will explore the importance of meaningful connections by looking at lessons learned during the pandemic and strategies for supporting ongoing connection with family members and friends. We'll share some resources to help support these meaningful connections, either through the phone, online, or in person, and ways to communicate with someone who's experiencing changes in communication due to dementia. We'll also provide you with some information on which services and programs are available to you right now during the pandemic. And then we'll finish by sharing some information about the First Link Dementia Helpline. And so part of the reason we chose this topic for our talk today is we were just reflecting and thinking that COVID-19 has been an incredibly difficult time for many people, and that many of us are feeling increased levels of stress and anxiety and uncertainty. And this is partly because the situation keeps changing. For example, the recent changes in policy here in BC. And so with so much out of our control, we're choosing to focus today on meaningful connections. In times of instability like this, our social connections can still be constant, but may look in a different way. So our talk today will draw from several great resources, and we'll make sure that these are shared with you in the follow-up email after our talk, as well as in the chat box today. So we wanted to start with a quick poll, and this is our first time doing one of these polls, so we'll see how it goes. Be patient with us. But we just wanted to know of our audience today what your relationship is with dementia. So if, Christine, you'd like to put up that poll. Our question for you in the audience is, are you living with dementia, or is someone in your life living with dementia? And your options will be yes, no, or I'm not sure.
And we just want to provide a short explanation about the I'm not sure option. That really refers to a situation where maybe you recognize memory or behavior changes in either yourself or others in your life, but maybe you just don't know if it's dementia or due to something else. So something to think about as you're choosing one of the options there.
And Mariana, are you seeing the poll from your end?
Yeah, the poll's there. We'll just maybe give another 30 seconds or so for everyone to make their selection, and then we'll hopefully see the results. So we'll just give another, less than 30 seconds. Okay, we've got the results. I don't know if you can see them, Avery, but I'll read them out. 41% say yes. So they're either living with dementia or they know someone. 37 say no, and 22% I'm not sure.
Mm-hmm.
So thank you everyone for sharing that information with us. And I just want to add a couple more notes here. So even if you answered no or I'm not sure, which is the majority of you, you might find the information that we share with you today is applicable to you even if you aren't living or caring for someone with dementia. We know that approximately 70,000 British Columbians are living with dementia, and this number only captures those who have had contact with the healthcare system or a confirmed diagnosis. So we know that this number is likely an underestimate. Now, according to the Canadian Institute for Health Information, 1 in 20 Canadians over the age of 65 lives with dementia. Now, after the age of 65, the risk of developing dementia doubles approximately every 5 years, with 1 in 4 Canadians over the age of 85 living with dementia. Now, what these numbers mean is that as you get older, you or someone you know might be affected by dementia in some way. So thanks again for sharing, and we'll move on.
So you can see from these two images I'm about to show you a reflection of how things have changed over the past year. So We've gone from gathering in a room like this that you'll see on the screen where, we're sitting around a table sharing food, and, we've transitioned to connecting virtually with our friends and family. So with that said, let's talk for a minute about COVID-19 and loneliness. So organizations like the Canadian Mental Health Association have long been raising awareness about growing rates of loneliness even prior to the pandemic, especially in older adults. So the UK has even appointed a Minister for Loneliness in 2018, really recognizing it as a key concern. However, the changes necessitated by physical distancing and other prevention measures have increased people's feelings of loneliness to the point where it's sometimes described as a parallel epidemic during COVID-19. So a recent survey conducted by Ipsos found that 54% of Canadians reported feeling more lonely and isolated. This survey polled Canadian adults of all ages. And then for people living with dementia and caregivers, these feelings have been even more heightened. So the researchers, Dr. Tam, Doso, and Robillard looked at the impact of COVID on people living with dementia and their care partners, interviewing hundreds of British Columbians. So people living with dementia were often more restricted and confined within their home, some without opportunities to leave the house to get groceries, attend regular healthcare services, access community networks, or receive home support. So in their study, they found that 83% of participants reported that they felt lonelier and more isolated than they did before the pandemic. The caregivers surveyed for this study nearly all said as well that not being able to visit a person they cared for in long-term care or palliative care due to restrictions on visitation was a major concern. So humans are naturally social creatures, meaning that loneliness can have serious impacts on our health. It raises levels of cortisol, which is the stress hormone. It can cause sleep disruptions and elevate our blood pressure. Loneliness may also make you feel anxious, irritable, or depressed. So it's really important to check in with yourself and be honest with others about how you're feeling. At the end of the day, physical distancing should not mean social isolation.
Now, one way to combat loneliness is to be socially connected, especially through connections which feel meaningful to you. There are benefits of connection for everyone, including people who are living with dementia. So we'll start by looking at some of the benefits. So staying connected socially helps you stay connected mentally. Research shows that people who regularly interact with others may maintain their brain function better than those who don't. And staying socially active and involved with life not only keeps relationships strong, but has many health benefits such as reducing stress and boosting mood. Connecting with new people in different settings helps open your mind up to new perspectives, widen your social network, and reduce depression and isolation. As well, social activity, whether that's casual interactions that you have with people or more structured like a volunteering role, can help all of us to continue to engage and feel fulfilled, ultimately improving our quality of life. Now, at this time during the pandemic, we need to be deliberate about our social connections because they're no longer built into our daily lives the way they were before. Now, in the next few slides, we'll be sharing some tips and strategies for communicating across different mediums, such as video chats, phone, and in person. These tips and activity suggestions were designed for people affected by dementia, but many of them can apply to all older adults. At the end of the presentation, as we mentioned earlier, we'll be sharing some resources with you so that you can learn more about some of these strategies and put them into practice. Now, as you are already probably aware, video calls have had risen popularity during this time. In the study that we mentioned previously, which polled people living with dementia and their caregivers, the use of technology was reported as a way to connect socially with their loved ones, with the majority of participants connecting with others at least twice a week. So let's take a look at some of the tips for making the most out of video calling. So start by setting the stage. Make it as easy as possible for the other person. If the person you're calling is unfamiliar or maybe unable to set up technology on their own, see if there's someone in their household or in their care home if they're living there who can assist them. You may need to call ahead to provide some direction on how to do this. Also, consider sitting down for a coffee and a snack and then starting a video call. That can make the conversation feel a bit more natural. Another tip to consider is just considering the best time of the day for the person that you're calling. For a person who's living with dementia, this is usually not early in the morning or during late afternoon when energy levels are typically at their lowest, but again, depends on the person in the situation. It may also help to establish a routine, calling at the same time of day. Now, you may wish to put a regular connection with people in your daily schedule to give yourself things to look forward to and encourage you to keep reaching out. And a last tip to consider for video calls is just start simple. One of the common pieces of feedback we've heard from people living with dementia is simply that their preference is to have one-on-one calls. While some people were comfortable with having multiple family members on a video call, most actually found it to be a challenge in differentiating who is speaking. This can actually lead to someone feeling lost in a call. Now, in addition to these tips, here are some activity suggestions that you can consider on your next video call. Play music. Now, we know that music touches every part of the brain and can be a particularly meaningful way of connecting with someone, whether you are in person or at a distance. Try playing a favorite song, or if you know how, playing a musical instrument can be a great way to connect too. One story that was shared with us was a woman who set up a video call with a friend of hers who lived in a care home. The woman played her guitar while playing traditional Christmas songs for her friend. Now, it lifted her friend's spirits and also the care home staff who were near the person at the time on the phone. So everyone benefited and felt connected in some way. Another thing to consider is sharing your skills. Teaching something to someone is a great way to boost self-esteem and have fun. Ask your family member to show you how to do something you know that they can still do well, such as playing the harmonica, or if they live at home and still own a car, maybe just showing someone how to properly wax a car. Whether you're living with dementia or supporting someone who is, we all have something that we can teach to someone else. You could also consider working on a project together, such as picking a recipe and cooking it together, or painting a picture, something that you can both do together through a video call while you're still talking about your day-to-day lives. And finally, consider doing activities together, like playing a game, for example. A colleague of mine told me a story of an incredible woman she knows who was diagnosed with mixed dementia. And while she had trouble navigating her way to and from the local mall in her community, she could beat anyone and everyone at crib years after her diagnosis. Think of a game that you know the person you're calling enjoys and try playing it over a video call, such as the classic charades or I Spy. There are many options online that bring interactive games and video calling together, and we will be sharing an activity resource at the very end, again in that resource document from McGill University that has some of these ideas that you can try out.
Thanks, Mariana. I wanted to talk a little bit about phone calls, which of course are a tried and true method for connecting and maybe more accessible to some than video calls. So while we're all familiar with phone calls, I just wanted to share a few tips. The first is to make it comfortable for yourself. You might wish to use headphones with an audio capability, like the ones that come with your iPhone, or put your phone on speaker to give your arm a break. I've personally really been enjoying putting my headphones in and calling someone while I'm out for a walk. I find it helps me focus on the conversation and get some exercise in too. As well, it always helps to introduce yourself over the phone. Don't assume that the person knows who you are or recognizes your voice, as it can be difficult without those added visual cues. We've heard from many people that phone calls are sometimes difficult these days. Sometimes it feels like there isn't much to talk about, as we may feel like we have less going on in our lives to update friends and family on. So we have a list of conversation starters to encourage meaningful conversation and reminiscence. Tips such as, tell me about your wedding day, or what are some of the things you're most grateful for? We also heard from someone who would read a page of her mother's favorite book to her aloud each day over the phone. So her mom would put the phone on speaker and listen to her favorite book being read to her by someone that she cares about. I thought that was a lovely idea. Another idea is you could read the news together over the phone and discuss it together. If you're finding the regular news cycle to be overwhelming, which I think is a common experience for many of us, there are good news story websites that you can look at and use, or you could look at magazine articles to talk about that align with your interests, so maybe on bird watching, for example.
Great. And many of the other tips for success that we've shared apply to in-person visits, such as finding the best time of day for a visit. Now, if you're visiting someone in a care home, inform yourself of their visitation rules so that you know what to expect. Ask about what you're allowed to bring in, such as food, for example. Another consideration is to support and don't do. Really think about the best type of activity that will promote success for the person and you. Demonstrate as you instruct and offer help only when it is needed. Be patient, slow down, and repeat instructions as needed. Remember that involving the person living with dementia in activities is not simply just a way to keep them busy. Activities provide valuable opportunities to share a meaningful moment and boost self-esteem. A last tip to talk about is to offer encouragement and gratitude. To be supportive and encouraging, say positive words and maybe avoid criticism. Thank the person or express your appreciation when the activity is over. Now, some activity suggestions for in-person visits include spending time doing something together. For example, turning on some music and dancing, or as the weather is starting to get nice in BC, which is a very welcome distraction, doing some gardening. Find projects that both of you enjoy doing, such as making a bird feeder, creating a scrapbook, or making a flower arrangement. These involve a little bit of preparation, but can be a great way to spend time together. Now, we've talked about reminiscing already, but reminiscing is also important in person as well. This is a great way to invoke memories from a person's lifetime that might not otherwise come up in regular day-to-day conversation. So if you're looking for some new conversation starters, consider asking a question like, did your car or truck ever break down? A question like this can lead to follow-up questions like, what happened? Tell me more about it. And then perhaps lead into storytelling like, oh, I remember the first time I had to change a tire. I was 16 years old. So it can really deepen a conversation at that point. And finally, a last suggestion here is activate the senses. Now that's referring to touch, smell, sound, sight, and taste. It can be a great way for meaningful connection. Some examples include bringing food to share together. This can be especially significant if you have cultural food to share. Now, it doesn't have to just be food. It can be drinks like a smoothie or a favorite tea as well. And consider also creating a sensory box. Now, this is also known as a memory box or rummage bins. There's lots of names for this, but the idea is that these boxes or bags contain everyday objects to support interaction. Similar to the idea of reminiscing, it allows people to connect with objects that can help invoke memories and create a connection to the past. So for example, seeing and touching a whistle can remind someone of a bad memory, maybe in gym class, or perhaps invoke a good memory of maybe a time someone spent coaching the swim team, for example. And finally, we want to leave you with just a few strategies that are helpful to know when you're communicating with a person who's living with dementia. We share these with caregivers and healthcare providers. However, these are really helpful strategies that honestly work in any kind of setting and are always good to remember when speaking with others. We'll start by looking at speaking slowly and clearly. Now, a person who's living with dementia may start to experience changes in communication. So keep in mind that their brain may be processing information a little bit slower than yours. The pace of your conversation will depend on the person's ability and where they're at in the disease. Using simple words and short sentences can really help make a message clear. And if the person has hearing difficulties, you might want to consider lowering the pitch of your voice, which is often better than increasing volume. It's often actually best not to shout. Doesn't always help. Another thing to consider here is sharing one message at a time. For some, hearing too many pieces of information can actually be very overwhelming. Too many thoughts or ideas at one time can actually lead to a lot of confusion. So it's best to break down instructions or thoughts into short single sentences, and in some cases, it's even best to limit choices. Give the person time to absorb what you're saying before moving on to the next sentence or idea. And finally, show and talk. So it's using your actions or gestures to indicate more information as well as your words. So for example, if you're living at home and you're trying to indicate to someone that it's time to go for a walk, pointing to the door or bringing a person's coat or sweater can actually illustrate what you mean. Now this is just a very small glimpse as to the many strategies and tips that we offer at the Alzheimer's Society. So again, it'll be referenced in the resource document, but I encourage you to read about our communication handout to learn more.
So we've given you some tips and strategies and things that can be done. But that said, at the end of the day, one of the most meaningful things you can do is just really be present for the person you're connecting with, both for yourself and also for them. So on a call, for example, doing your best to be fully present, just trying to give your undivided attention, resisting the urge to multitask. At the end of the day, each day brings the opportunity for a new connection. So try to make it as positive and meaningful as possible.
We would just like to, the last two slides that we'd like to show you is we'd like to share some information on our support and education programs that Mark kindly introduced at the very beginning. Our First Link Dementia Support connects people living with dementia, their caregivers, and families to support and education at any stage of the dementia journey. Because of COVID-19, of course, we're currently providing virtual services. Now, in terms of support, we currently offer support through our telesupport groups for caregivers, and we're in the process of launching our telesupport groups for people who are living with dementia. We also offer one-to-one support calls to all clients and our First Link Dementia Helpline, and our now online fitness and social program called Minds in Motion. We also refer to other healthcare and community services as needed. Now, in terms of the education side of things, FirstLink also offers opportunities to learn about the disease, including our workshops and wellness series. Now, since the onset of COVID-19, we've had to expand our webinar series, offering weekly sessions that are recorded and available online. And we also publish quarterly newsletters for people living with dementia and caregivers, as well as education e-blasts. Now in the chat box, Avery is going to kindly share a link to a resource document that contains several links to documents that we've referenced throughout our presentation today. It also includes our contact information and key links on our website that you might find helpful. The First Link Dementia Helpline, which the information appears on the screen in front of you, is available throughout the province and accessible to everyone, not just people who are affected by the disease. We encourage healthcare providers, first responders, and members of the general public to call with their questions about the disease and supporting people living with it. We offer this helpline service in English, Mandarin, Cantonese, and Punjabi. Just like to give a couple examples of why people call us, why people call the Dementia Helpline. They want to learn more about the Society's programs and services, like the ones I just described to you in the previous slide. They want to learn about issues around communication and behavior, or home and community supports that are offered by the health authorities. Some people want to talk about challenges that are related to caregiver stress, or just learn about information, anything regarding dementia, really. Now, since the pandemic started, we've been receiving quite a few calls related to COVID-19, generally focused on addressing communication and behavior challenges that caregivers are experiencing in light of isolation and physical distancing directives. Now, this brings us to the end of our presentation today. Thank you for your attention and for participating. We hope that you've come away today with at least one new idea for making your connections meaningful in your day-to-day. Thank you, and we hope that you enjoy the other talks this afternoon.
Thank you.